Good morning, Dr. Richard Buckley. I was going to say it's Monday, but it's Thursday, so we got that sorted out. Our patient's here and awake, yep.
Good morning.
Oh, wow, there you go. And the abdomen's numbed up. Today's project is permanent removal of fat from our patient's abdomen, waist, and then onto the back side, the lower back, the hips. And in addition to sucking some fat out, we're also going to give a Renuvion plasma energy tightening treatment to the abdomen. We're able to accomplish this permanent fat removal using what's called tumescent local anesthesia. So you can see it's a little bit whitish here as compared with pinkish there. There's some epinephrine under the skin along with the lidocaine, which helps minimize bruising. Often enough we don't even see any bruising with our lipo procedures. And whatever fat cells we take out, they're gone for good, and after puberty you do not make new fat cells. Very good news this Thursday morning. And sometimes people want to know how many pounds of fat we're going to take out. It's not about just weighing the fat as we go along and taking out a certain poundage and thinking that that's going to give us the curvatures we want. It's all about making the curvatures, in other words, sculpting, and then when we get done with the sculpting, it's however much fat out that it is. And also, and understandably, many people would say, okay, take every little drop of fat out that you can. You don't really want to do that. I mean, right now, I can grasp this amount of skin and fat and a little tumescent fluid. Later on, you'll find that it's quite flattened out. You always want to leave a little bit of layer of fat everywhere under the skin so that things, remain smooth. I have this little cannula stuck in our patient's abdomen just to show you how comfortable it is. You told me that when I take some device and put it in the little poke I made, you didn't feel that at all.
Not at all.
All right. So this is one of many little devices that we can use as a straw to put our suction on and to then suck fat out through these tiny little holes. And I have many different kinds of these micro cannulas with different hole configurations and different diameters and different lengths. Some are very short and some are a little bit longer. This kind of a medium-sized cannula here. So thank you for watching Milford MD. Maybe I'll bring you back a little later and show you something more. We're going to get on with sucking out some fat. And actually, can you just fire up the suction for us? And are you still live? Yeah, okay, just fire up the suction and we'll show some fat coming out here. If you look right here on the tubing, and can you zoom in on that? So you're tight on that. Nothing's happening because A, there's no suction, and B, I'm not moving. So in order for fat cells to come flying out where they're out of here, I need to move and there needs to be suction. Now there's suction. I see the number up there on our equipment. And if I move, the cannula is going to start filling up with fat. And if you watch here, you're going to see the fat is starting to accumulate. If you look here in the tubing, you can see there's some fat. And we'll just keep going all over the abdomen and take the fat out smoothly and move on to the left and right waists, and then on the other side, the lower back and the hips. I'll bring you back a little later. Sounds exciting. Our patient's excited, so let's go. We're going to work. Thank you for listening. Milford MD, this morning's project, you remember, is the Lipo 360. We lipoed on the front, sculpted the waist so they're curvy in now, and sculpted the lower back that's above the hips, so that the hip area. And also there are a couple little areas we marked here for some nice little divots, some dimples. So in a moment we're going to have our patient turn over. You awake?
I am awake.
She's awake. So we'll have her turn over and then we'll do the Renuvion plasma skin tightening on the abdomen on the front side. That skin tightening with the Renuvion can be done anywhere on the body, really. But we needed to get these waists sculpted in and get our little dimples created there. So it's looking very nice. So interestingly enough, in sculpting these little areas, and we have so many different choices of cannulas that I can use, but I can be working here and from this side here. So I'm putting this in a little poke hole here, little entryway that I've made, and I'm all the way over here, and I'll poke that so you can see it out a little bit like that. This is the smart hand. That's where I'm actually working. This is just an entry place. But you can see from entering over here, we're able to put that all the way over there for our patient. You didn't feel that at all, yeah?
No, I'm completely comfortable.
Okay. Sometimes when we work towards the border of where we've numbed, then things can get a little bit sensitive. So we always work on trying to stay within the borders that we've drawn, those borders being the areas where sculpting would be very nice. So once again, thank you for watching. Milford. She just asked me, is there a warm sensation with this Renuvion that I'm going to be using? I wouldn't say there's a warm sensation. The abdomen's fairly numb. In many cases, there isn't any sensation other than maybe me working around a little bit with my hands. Sometimes there's a little pinch. It feels like a little electric pinch. So we're just live, and we'll see how you feel, okay? So you'll tell the world how you feel. Hopefully you don't say anything wild. But anyway, here we go. I'm going to lay down a little bead of plasma energy. So you felt a little pinch?
A little pinch, yeah.
Okay.
It spooked me more than it hurt.
Okay, spooked you, all right. And you can see this kind of puffed up in here when I did that. I don't know if you can hear this, but there's some gas that I'm able to squeeze out through the little poke holes here. That's the helium gas that we ignite into a plasma with radio frequency energy. And it comes out on purpose through our little poke holes. So this is Renuvion tightening energy.
It's very mild pinches.
Occasionally, right?
Yeah, it almost feels like if you had pins and needles.
That sounds lovely. But I take it as quite tolerable.
Very tolerable.
Yeah. And the pins and needles are just occasionally, or they're like all the time?
No, when the machine's just on.
Okay, when it's off, nothing's happening.
Almost as if like your foot fell asleep.
Ah, I see. Well, so that's maybe some numbing feeling, really.
Ooh, that pinched. Is that close to the belly button?
It was, yeah. So thank you for watching Milford MD, Renuvion.
Point 8.